Dale Gordon, D-A-L-E-G-O-R-D-O-N. I wasn't really having any symptoms. There wasn't any of the classic symptoms of, cancer. That test was really important. I wouldn't be here today.
Beginning at age 50, everyone should take a yearly fecal occult blood test so colorectal cancer can be found early. The new standard of care in fecal occult blood tests and an important advancement in early detection is the fecal immunochemical test, or FIT screening method. FIT is a simple, non-invasive test that is more accurate in detecting lower gastrointestinal bleeding. Annual redundant screening is the key to finding and fighting this disease at an early stage when it is treatable and beatable.
I had a swollen knee. I went into the doctor to get that checked out. And in the process of getting that checked out, the doctor researched my charts and realized that I hadn't had any testing done in the last 15, 20 years. So she gave me a fecal sample kit to take home and to send back. And that's how they found out about the cancer. If I hadn't have taken that test, what they found later on probably would have killed me, the doctors have said.
We've seen an increase of 28% in early detectable cancers and precancers. If we can find it early, we can treat it early and save lives.
If I hadn't went in for my knee and given that fecal sample kit, there's a really good chance that I wouldn't be here today.
We're thrilled to see that our screening rates have increased from 49% in 2006 to over 70% in 2009. That's almost a 50% increase.
A lot of people I come in contact, everywhere I go, I try to get them to take this kit and this test.
The new fecal immunochemical test called FIT is much easier for patients to comply with. It detects microscopic blood throughout the intestine. It's more sensitive and specific. It's a screening test that's known to detect cancer and can save lives.
They can be in the early stages of cancer, not even know it, but with this simple test, it'll detect that hidden blood that's caused by the cancer, and their survival rate will be very, very good.
Our colon cancer screening rates started to increase significantly since 2006 when we started using the new fecal immunochemical test. With our early detection program, we've seen our stage 4, our most advanced type of colon cancers, decrease by almost 30%.
Get the kit, go to your doctor, request it. I'm sure the doctor will be more than happy to give it to them, and it's a little bit apprehensive, Jay, when you go in and do a test like this. I know I was when I did it, and I know most people don't, many people that I've talked to, they don't want to know whether or not they've got cancer, but with this simple test, you can detect it in the early stages, and the surgery's pretty simple. It's a pretty simple surgery, just removing a portion of that cancerous colon, and they'll have 20, 30, 40 more years to live.
Last year we spent over $150 million on chemotherapy to treat advanced colorectal cancer. If we can detect cancer at its earliest stage, we can prevent patients from undergoing chemotherapy, radiation therapy, and advanced surgery. Isn't that the experience you would want if you were a patient? Isn't that a better way to use our healthcare dollars?